Hello and welcome to this special presentation on how to help bulging, herniated, or degenerative discs without drugs or surgery. And I am your host today. My name is Dr. Vince Leone, and I'm part of a group of chiropractic specialists who all focus on disc-related conditions. We're located around the country, and we have all invested a tremendous amount of time, energy, and resources into specialized equipment and training so that we can help patients with these disc conditions recover and have long-lasting success and relief. So what are we going to cover today? Well, we're going to talk about some quick stats on back pain and disc conditions. We'll talk about the different types of disc conditions and the symptoms that go along with them. Talk about causes of disc conditions, how to tell if it's a disc or if it's something more common and less severe like a sprain strain. Then we'll dive into common treatments for disc conditions, and then finally what we do that is so different yet so effective. So first of all, quick stats on back pain in general. Affects over 30 million Americans. That's a huge number. 8 out of 10 Americans will be affected by back pain at some point in their life. It's a little more common in women than men. Among desk workers, 54% report back pain due to the type of work that they do. And then 9 out of 10 patients, this was kind of sad, 9 out of 10 patients that go in to see a chiropractor, a physical therapist, or a massage therapist, they're never given a diagnosis, or even a medical doctor. They're never given a diagnosis. They're just saying, hey, do this, and then you'll get better. And unfortunately, a lot of times they don't. So now let's shift into quick stats on disc conditions. So more than half of older people, so when we say older, we're talking mid-50s and above, have some degree of disc bulging. Okay, 10% get surgery, can take several months to heal. In this case, with disc conditions, it's men, 2-to-1 over women, and 90% of disc bulges occur in the low back. Now let's talk about the types of disc conditions and then the secondary results that stem from them. So bulging or herniated discs are very, very common among, I would say, relatively younger patient population, 30s, 40s, 50s, right? And that's essentially, I'm going to show you in a picture in just a moment of what that looks like, but essentially the disc is injured, it is compressed, and then that's why you get the bulge. And if it's really bad, it ruptures the edge, what's called the annulus fibrosus, and that's when we get the herniation. Now, when we have this type of condition, typically we'll have what's called sciatica, and that's where we have pain down the leg. Now, the sciatic nerve is the largest nerve in the body. It exits in that L5, which is the last spinal segment in the spine. And it exits at that level, travels into the buttock, down the leg, all the way to the foot. Now, degenerative disc disease, on the other hand, is where it is essentially an age-related condition, and the disc has lost water content. So when the disc is healthy, it's 86% water, and over time, it can lose that water content, typically if we become very sedentary. So what we have seen, the data shows that about 80% of patients 65 and older have some form of degenerative disc disease. A couple other types of disc conditions, facet syndrome. Facets are the spinal joints, and when we have facet syndrome, that means they're damaged in some way. A lot of times that comes from a disc condition. Pinched nerves come from disc conditions, and then numbness in the back, legs, or feet. When we get pressure on those nerve roots, right, because the disc is collapsing and it's putting pressure on those nerve roots, we're going to get some type of symptom, pain, numbness. We can get cramping in the legs, we can get weakness in the legs, so we need to take the pressure off those nerve roots so that the nerves can function normally. Now let's look at some broad-based symptoms from disc conditions: pain, numbness, cramping, tingling, weakness, burning, aching. Now these can be locally in the low back, or they can be down the legs. Now what's really a recipe for disaster is when an elderly patient has weakness in the legs due to the disc condition, and they have numbness in the legs, right? Because what that can do is then lead to falls, right? And then that can lead into a whole other host of conditions. But essentially, when we have pressure on the nerve root due to the disc being collapsed, we affect the blood supply down the legs. And so when that happens, the muscles aren't getting their nourishment, and that's why they become weak. So this is, again, it sets patients up for really bad outcomes. Now, what is typically going to cause a disc condition? So it's trauma-based. In other words, car accidents, work injuries, and weekend warriors. This is kind of what we see. Car accidents, obviously extremely traumatic, especially, when you're at 30, 40, 50 miles per hour. Work injuries, you're trying to lift too much in a poor position, you're trying to get stuff done, you slip and fall. All those can lead, obviously, to an injury, and that can in turn lead to a disc condition. And then weekend warrior, whether that's motorcycle riding or, you're trying to do too much outside around the house in the yard, or you're going one of the Spartan races, like where the kind of extreme races. All we see disc conditions come from all of those situations, but it's a traumatic situation is when it usually happens. Now, how do you tell the difference between a disc condition and like a sprain strain? So a sprain strain is a very common back pain condition that chiropractic and physical therapy and massage therapy does wonderful with, okay? It's now with the sprain strain, we literally get some tearing of the muscle. Sometimes the spine can shift. And so with chiropractic, physical therapy, massage therapy, they do great with this. But it usually stays local, right? In other words, it doesn't travel down the leg. It's or the arm, if the issue is in the neck. It usually stays local in the low back. It doesn't travel. With the disc condition, oh, and by the way, with sprain strain, that'll typically resolve in about 6 to 8 weeks. That's a time frame that the body typically takes to heal that. And with the chiropractic or the physical therapy or the massage therapy, it helps that process along, and primarily so that you are stronger when you come out of the injury and you don't have any long-term symptoms or ramifications. Now with a disc condition, we're going to have typically radiating pain, so it's going to travel down the leg, down the arm. It's going to be chronic, so it's going to continue past that 6 to 8 weeks. It could go 6 to 8 months. It can go years, because it's not traditionally resolved by therapies like chiropractic, physical therapy, and massage. And we'll talk about why in a second. It's typically very high on the pain scale. 7, 8, 10. Sometimes patients say it's a 12, right? So whereas a sprain strain is it hurts. Like, don't get me wrong, it hurts, but it's more like a 5 or a 6. But and it's usually dull and achy and kind of persistent. But with the disc conditions, it's usually sharp. It usually makes you catch your breath, and it can be exacerbated by bearing down. So if you sneeze or you have a bowel movement where you bear down, that a lot of times can exacerbate it or make it worse or make it jump up on the pain scale. Now, what are some common treatments for disc conditions? Well, drugs for one, and it's typically heavy-dutier drugs than, say, just an Advil or something like that. But, patients will take extra-strength Tylenol. They'll take opioids, which is a massive problem in the United States. They'll do injections, right? And corticosteroid injections, which, by the way, are not FDA approved for back pain, though they're still widely recommended by medical doctors. I have no idea why. And then surgery for disc conditions and questionable outcomes on surgeries. Now, don't get me wrong, some patients need surgery, but it's a low percentage, and there is a high percentage of failed low back surgery and repetitive back surgery, okay? So what do we do that's so different yet so effective? Well, it's called spinal decompression therapy. And if you're familiar with traction, you lay on a table, it's going to kind of pull on, like say the low back. It's going to pull on the low back and it's going to hold that over 10, 15, or 20 minutes, and then it will release. Okay, so it's the big difference between spinal, because spinal decompression came about in the late 90s, and it was essentially the evolution of traction. Traction's been around forever. So, but spinal decompression as compared to traction, very important. First of all, it's a much more advanced version. There's a computer in this unit here that essentially get your height, your weight, your level of involvement. In other words, the disc that is injured is all inputted into this computer. This is going to elevate so that it targets that disc. It's very specific. So traction is non-specific, okay? And it's static. In other words, it's non-specific. It's going to pull on the whole low back, and it's static. It's going to pull and hold for the entire time period. Spinal decompression is going to be very specific to the disc level that the patient's experiencing, and it's going to pull and release, pull and release, pull and release many, many times over the course of typically about 20 minutes, so that it creates a vacuum effect in the middle of the disc. So why is that important? So the disc is 85% water, okay? And so when it is injured, it is somewhere less than that, and everyone's different. But the point being is we need that water pressure. That's where the disc derives its strength. And the best analogy I can give you is a tire on your vehicle. And if we're looking at the front left tire on your car, if it's at the proper PSI, or the pounds per square inch, then it has the proper height. It has the proper strength, and it can do its job, right? But now, and say that's 45 PSI is the proper inflation rate. Now, say it's half that. Say it's 20 PSI. Well, now it's half as tall, half as strong, and it really can't do its job. I mean, can you imagine going down the highway at 60 miles per hour with the front left tire that's half its strength, half its height? Do you think it's going to do a good job? No. Same thing with the disc. Okay, the disc job is to stabilize the spine and to be a shock absorber between the spinal segments. So what happens is this is a herniated disc, right? So this is called the annulus fibrosus, and this is called the nucleus pulposus. So when we have an injury, it ruptures this annulus fibrosus, the nucleus pulposus pushes out, and that's when we get that pinched nerve, right? So that's when we get pressure, say, on the sciatic nerve, and it sends pain down the legs. Now, what the spinal decompression does, okay, when it's pulling and releasing, it creates a vacuum effect. In other words, negative pressure in the middle of the disc that allows the disc to absorb water from the body and become strong again and plump up again. We're pumping up the tire, if that makes sense. So let's take a look at what it looks like in kind of an animation form.
Lays comfortably on the table as the motorized traction gently takes pressure off the disc and nerve, allowing the spine to heal.
See, water is going back into that disc, allowing it to plump up again. So that is the power of spinal decompression, and even though it's been around for quite some time, still a lot of people are not familiar with the power of this therapy. So, is it safe? Absolutely. Okay, it's absolutely safe. It's FDA approved. The machine will cut out at resistance. In other words, if your body is fighting the spinal decompression machine, it'll just stop. Okay, and it's very gentle. Like when it pulls, I mean, it's not pulling an inch. It's pulling it's pulling millimeters and releasing, pulling millimeters and releasing. And a lot of our patients, they'll fall asleep. It's the first time they've had pain relieved. And we have an excellent recovery rate of about 84%. And then we have great research that backs up this particular therapy. Now, another question we get a lot is it covered by insurance? And by and large, no. Unfortunately, it's not. And the next question I always get is why? Well, I don't know. Okay, I don't know. I kind of stopped trying to figure out what insurance companies decide to cover, yes or no. They consider spinal decompression an elective procedure similar to like LASIK eye surgery, okay? Even though we have the research, even though we've helped thousands of patients around the country, they have chosen not to cover it. So I'm sure you're trying to figure out, well, then how much is this going to be if I was interested in pursuing it? Obviously, different doctor offices have different prices, but by and large, it's around $75 to $125 per visit. And the doctor, when you come in for an evaluation, he'll determine or she will determine, whatever the doctor is, will determine the severity of the condition and then how many visits they would recommend. Okay? So what did we cover today? Well, we talked about quick stats on back pain and quick stats on disc conditions. Talked about symptoms from the disc, causes of the disc condition, how to tell if it's a disc condition from, say, a sprain strain. Then we talked about some common treatments for disc conditions like drugs and surgery and why they're not really a good solution. And then we went into spinal decompression and how it's different and so effective. So how do you determine if you're a good candidate? Because not everyone is a good candidate, unfortunately. Well, you need to obviously see a specialist. They're going to do a health history. They're going to do an evaluation, which is going to include a physical, an orthopedic, and neurological exam. They're going to do imaging. So they'll either take x-rays in the office or send you out for an MRI. And they'll take all that information and they'll determine, A, is it a disc condition? B, what is the severity of the disc condition? And C, is this patient a good candidate for spinal decompression?